before we move into our first panel discussion, just a reminder there, please share your thoughts and suggestions using the hashtags #ICS 2025 and #India Climate Summit. And now it's time for our first panel discussion, where we are going to be focusing on one of the most urgent climate challenges, that is extreme heat. With global temperatures rising, heat waves are becoming more frequent, intense, as well as deadly, making heat a complex, multi-dimensional hazard. Its impact goes beyond health, disrupting agriculture, water, energy, urban systems, and even economic productivity, Amita.
Absolutely. And with these times that we have been witnessing, this session holds all the more importance, because this session, which is titled Weathering Heat and Hazards, Playbook for Climate Resilience, that will be moderated by my co-anchor Hina. Please join me in welcoming our distinguished panelists on stage. Please join your hands together for welcoming our panelists. We have Ms. Karuna Singh, who is the Regional Director for Asia and Earth Day Network, joining us here on the stage. Dr. Mrutyunjay Mohapatra, who is the Director General of the India Meteorological Department, also joining us here on stage. Good afternoon to you as well, sir. And also joining us on stage, this esteemed panelist, Dr. Harshal Ramesh Salve, who is the Additional Professor at the Center for Community Medicine at the All India Institute of Medical Sciences, New Delhi. Hina, over to you.
Thank you, Amita. So, ladies and gentlemen, we are here to talk about heat wave because it is a reality. Heat waves are becoming more intense as well as deadly. I want to begin by asking you, in fact, each one of you, I want to ask each one of you, if, in perhaps a sentence, if you could tell me and tell our audience, the biggest heat-related risk that India is facing today. Let's start with you, ma'am.
It's to the health of all living things and to the planet.
Okay, it's about our health. Dr. Mohapatra?
Yeah, heat kills and it causes the diseases. So therefore, it is very much essential to monitor the heat and take the adapting and mitigating measures to keep ourselves safe and healthy.
Okay. Dr. Salve?
Thank you. I will describe the impact of heat as a tip of the iceberg. We only know the tip. We don't know what is beneath the waterline, and that's our aim, to know about it more. Thank you.
So if it's just the tip of the iceberg, then definitely it needs a discussion. It needs an understanding also, and also, like you said, heat kills. So we need to find out what should really be done. And Dr. Mohapatra, like I said, heat waves are becoming more intense as well as deadly. It wasn't really the case, say, a decade ago or maybe 2-3 decades ago. But today, almost on a daily basis, at least in the summer season in the northwestern part of India, we are talking about extreme heat wave conditions that are likely to prevail. If you could tell us a little bit about how the frequency and the intensity of heat waves has really changed, say, in the last decade, and why is it happening?
So India Meteorological Department, being the nodal agency for the country, maintains the record of temperature, and we have got the record of temperature in digital format since 1901. It shows that there is an increasing trend in the temperature, both the day temperature and the night temperature, and especially since 1970 onwards, if you will find that there is a rapid increase in temperature, and considering the past 2 decades, there is an accelerated increase in the rise in temperature. As a result, there is increased frequency of the heat waves, increased duration of the heat waves, increased intensity of the heat wave in the heat-prone areas, that is mainly the northern India and central India. Not only that, the area which was earlier prone to heat wave, that has expanded. Even in South India, up to Tamil Nadu, up to Kerala also, nowadays, we experience the heat wave conditions. Further, the duration heat wave, usually we get heat wave in the month of April, May and June before the advance of monsoon. But nowadays, even you can expect heat wave in the end of February and March. And in July also, you can get the heat wave conditions. So therefore, the impact of heat wave in recent years has increased, mainly because of the anthropogenic activities or human-made activities. We have pumped in the various greenhouse gases which are helping to increase the temperature of the surface of the earth. These greenhouse gases are mainly the carbon dioxide, nitrous oxide, and many other originating from different sources like, say, industries, the transport, the human being itself, the population is also increasing, and also at the same time there is deforestation because of the human greed. We are also exploiting the natural resources. So as a result, it is not simply limited to the rise in temperature or the heat wave conditions, but this is affecting the various types of extreme weather events. For example, the monsoonal heavy rainfall events are increasing over the central India and peninsular India, and there is a relocation of the behavioral pattern of the monsoon rainfall. For example, rainfall is decreasing in recent decades over northeastern states and adjoining eastern India, and is increasing over northwestern part like Saurashtra and Rajasthan. Okay. Similarly, there is also increase in thunderstorm frequency and lightning frequency. While we have been able to minimize the loss of lives due to cyclones, now number of lives lost in lightning is increasing.
Okay, so it's actually impacting a lot of other things as well. And like you're telling us earlier, while it used to be around, say, May, June, extreme heat wave conditions used to be there, but now we are seeing it starting perhaps from the end of February itself. So that is definitely a cause of concern. Ms. Singh, if you could, also tell us a little bit about what could be the reason behind it, this sudden change in weather. I mean, we all talk about climate change, etc., but that's like a very heavy word. But why heat wave?
I think a lot of it is due to anthropogenic activities that are happening. And those are happening because we are not making our people aware of how these anthropogenic activities are causing global warming and the resultant climate change and the heat waves that are happening. Human beings are not suicidal by nature. They're survivalists. So why is it that we are not doing something to reduce the global warming? I think it is because awareness is not being given at the school level, beginning with the school level. We have to make our children aware that their habits, their activities are leading to global warming. We don't have the elasticity of time to wait till they become adults and then become stewards for the environment. So this, I think, lack of awareness, lack of education, not mandating climate education at the school level is one of the major causes why we are continuing to see these heat conditions that are coming about.
When you say that, these are some of the activities, at a young age that are leading to the situation that we are seeing right now. If you could just describe maybe a few of those activities for our audience here, for our viewers.
Simple things like switching off the lights. Unless the child understands that switching off that light when you don't need it is going to cause extra heat, they won't do it. They have to understand that. We have to understand the benefits of increasing the green canopy. Children must understand it. Schools are now encouraging children to plant trees, look after them, plant them on your birthdays, let them grow as you grow. These are activities, simple things that should be inculcated in our young citizens at a very young age.
Okay, so there's a lot, of course, that can be done if the behavior is changed at a very young age. Charity begins at home, they say.
Just to add to that, our Honorable Prime Minister's Mission Life initiative talks about all this, but are we initiating it right when the child is even 4 years old?
Okay, interesting. Dr. Salve, now, what are some of the most pressing health challenges or impacts, really, rather, of extreme heat or heat wave conditions that people face?
Yeah, thank you. And this is a very important but difficult question to answer. As I said in my opening remarks, the impact of heat is a tip of the iceberg. What we see is only tip. what we see in the news reports regarding deaths due to the heat wave most of the time, strokes happening due to the heat wave most of the time. So this is, we are talking about tip of the iceberg. The major burden in terms of the cost, in terms of the morbidity, what we call in the health term, lies beneath the water table, which is largely unknown. These are what? These are heart failure. These are what? These are arrhythmias. These are what? These are hypertensions, right? This is a cardiovascular, the heart and its related system get impacted due to the heat. And it has two dimensions. One is the acute exposure of heat. If there is a higher temperature, you are exposed to it acutely for short duration, you will have the acute symptom. But if you are exposed to the heat for a longer duration, for the chronic period, then the chances of having chronic diseases, chronic impacts are more. It can be due to the heat, the allergens in the environment also get activated. So the people having asthma, COPD, the exacerbation chances are also there. So both cardiovascular related issues and respiratory related issues are linked with the heat. And most important and tricky part, and I think where the role of Times Network and the communication people comes in, is these impacts are not visible. So it is very difficult to convince both policymakers as well as the common public to take actions against it, to take remedial measures. So it is the job of communication experts and the media to generate awareness regarding this chronic impact, the impacts which are not visible, which are not acutely visible, which are not instantly visible, right? This is the most important thing we need to do. Then you said about heat wave. The terminologies we mostly use are heat wave, which tells you about the intensity of the heat, the increased temperature, and the definition varies. The definition of heat wave in India is different than the definition of heat wave in UK. That depends on what is there exactly, the routine temperature. So then the duration and the intensity defines the heat wave. There is something called as heat stress. You will see that terminology which is coming up. This is the impact of the heat on the individual. If you take out your phone and just see your weather application, you will see 42 degrees Celsius feels like 48. Have you noticed that? So that is what the impact of it, on the subjectivity involved, we call it as a heat stress. The third terminology we use in epidemiology is heat-related risk. Now here, the most important part which comes into the play is the vulnerability. Who are more vulnerable to heat impact? We all work in heat, mostly all young people work in heat, laborers, traffic policemen, but none of them most of them are healthy. So who are most affected? The people who are comorbid, people who already have cardiovascular diseases, respiratory diseases, and who occupation-wise have more exposed to the heat for a chronic duration, for longer duration. The people who are living in the slums with the asbestos sheet, which lead them more to the night, as sir said, regarding night rise temperature. So night rise temperature doesn't allow your body to cool it down. So that has a chronic impact. Right? So when we talk about the heat-related risk, and we should talk about when we are addressing the solutions and the mitigation measures, who are more vulnerable, which area, because we are countries within the country as a nation. So the western part is more vulnerable with respect to desert area. The mountain-related parts are having more UV radiations, and all these issues are there. We need to map the country, block, cities, depending on the heat risk.
Right.
That is what the way forward. Thank you.
Now, Dr. Mohapatra, now ladies and gentlemen, for those of you who don't know, then Dr. Mohapatra is also known as India's cyclone man because he has accurately predicted severe cyclones in the country in the past, and that has helped India save a lot of lives and damage to public property as well. I think he deserves a round of applause there. And Dr. Mohapatra, similarly, do we have a robust system in place or some kind of an early warning system to be able to tell or predict heat wave conditions, for how many days are they going to be present, which all regions, etc. Like we have accurate forecast mechanism for cyclones, do we have it for heat waves?
Yeah. So thank you very much for your compliments. Yes, the heat wave prediction system or early warning system is in place. but it is not like cyclones. While cyclone is a rapid development within 5 or 7 days, it is being predicted, the heat wave is a slowly evolving system. So therefore, it is very much essential to monitor the temperature on daily basis and predict. And as and when it exceeds the thresholds, which can be harmful or fatal to the human being or our livestock or our livelihood, like agriculture, water resources, horticulture, or power sector, or our transport sector, then we issue the heat wave warning. The heat wave warning, as Dr. Saab was telling, consists of the various factors which can have impact on the human health and life, and of course, our environment. The first and foremost is the day temperature. When day temperature exceeds by about 5 degrees Celsius from the normal temperature, we declare heat wave and we expect such type of situation, we predict that. But night temperature, as is told earlier, it becomes more dangerous if it is higher than the normal. So whenever night temperature is 5 degrees higher than normal and when day temperature is also high, we also give warning for warm night conditions. Third factor is that because of this global warming, the temperature is rising. For every 1 degree rise in temperature, there is 7% increase in relative humidity. So therefore, the atmosphere has now the higher capacity to hold the moisture. So whenever there is increased temperature, heat wave conditions, especially in the coastal areas, you have got enough humidity, therefore it becomes unbearable. It becomes more disastrous. So considering this, we have introduced in last 3 years the humidity forecast, and we have enabled one index called temperature humidity index, which takes into consideration the heat stress, or you can say discomfort index. Then next one, to improve the information for the public about how severe will be the heat wave conditions, we give the percentile, like 99th percentile, 98th percentile, or 95th percentile of temperature, whether tomorrow the temperature will exceed 95th percentile. Then people will understand that this is going to be one of the worst heat wave conditions. Apart from that, in northwest India, there will be wind conditions. If it is a dry northwesterly wind coming from, say, Punjab or from Pakistan towards Delhi or towards Madhya Pradesh, it becomes more disastrous. So therefore, we also improve our forecast. Every day we issue for next 7 days forecast, all these parameters. We give indication whether it is going to be a low condition in northwest India, or similarly, whether the land breeze will be severe and sea breeze will be weaker in the coastal areas. Sea breeze brings colder air and heat wave gets mitigated. If there is weaker sea breeze, then heat wave condition continues. Last point, what we do actually, we provide the persistence. How many days heat wave conditions are continuing? Because human body can adjust for 1 day or 2 days. If it is continuing for 3 or 4 days, then human body fails to adjust itself. So therefore, the persistence is also taken into consideration, and future also, if it is persistently going to occur, accordingly we give. So considering all these 7 parameters, we have developed an index, composite index, to evaluate the impact of the heat wave expected for the next 5 to 7 days. It is provided at the city level. It is provided at the district level. It goes to all the agencies, starting with Minister of Labor to Minister of School Education, disaster managers, etc. Also, I'll give an example. In Delhi, it goes to Rickshawala Association. It goes to Street Vendors Association, as they requested us, and also we contacted, and it's going to. And apart from that, whenever there is heat wave condition, the common alerting protocol introduced by Government of India, that is utilized, and whether it is smartphone or not smartphone, the information goes to each individual. For the area where IMD provides the warning, if you have got a phone, you will get a message in local language. Further, what we have done actually, we are giving now the impact-based forecast in color-coded format. It is green, yellow, orange, red, indicating the severity and also the actions required for that. So damage expected, say for example, standing crops, damage expected towards the animals, damage expected to the human health also taken into consideration. Last point, what Dr. Saab told, when the heat wave condition is there, the lower tropospheric ozone concentration increases. So therefore, those who have got chronic breathing problems or health-related issues, they can have the problem further severity. So therefore, we also give indication about the condition of the air quality and also the condition of the ozone in the lower troposphere. So all these informations are round the clock provided to the people, and at the same time, some kind of IC materials, awareness campaigns are also carried out so that people can take actions when there is a heat wave conditions.
Okay, so data is being provided. We know it's a problem, but are we even taking it seriously?
We have to take it seriously because it's affecting us. But the real problem, if I might add, is that humans think that they have mastery over nature. Our ancestors lived in harmony with nature, and so everything was all right. Today we think that if it gets hotter, we'll just add another air conditioner. But look at the olden times. What did they do? What did Red Fort do? Which is now being followed by Terry in their Gwal Pahari, hostile conditions. The underground subterranean air quality, air temperatures are between 25 and 30 degrees Celsius in Delhi, even when Delhi is 53 degrees Celsius. So they had channels to bring this up. That is how they did it. We have to go back to these things. There's the albedo effect, where you paint your roofs white, and that reflects the sun's rays back from there. So in the olden days, all our houses had white chuna on them for this reason. Now we have the modern paints that have a lot of plastic in it also, so it just absorbs everything. There's a mosque on the coast of Karnataka, the Badri Mosque. What have they done? They have increased their minaret to 70 feet. At 70 feet, the cool air is being brought down to the prayer halls and cooling them. So we have to go back to these conditions, and people are going back to these conditions. We cannot keep adding glass houses and living in them. That will just keep increasing the heat. As the question was asked earlier, are our air conditioners going to be reduced to 24 degrees minimum, or are we going to continue to put them at 18 and 20 and just keep adding more of them? The Siddhivinayak temple has done that. They have painted their roof white, and they've got the cool roof, and it's known as the greenest temple in India.
In fact, some reports also suggest that if you paint the roof white, then your temperature can come down by about 2 to 5 degrees.
Absolutely. It's called the albedo effect. And so this is science matched with practical, elements.
So we know what the problem is. We have the solutions as well. It's only about implementation now. Dr. Salve, I want to ask you, I was looking at some data. Between 2000 and 2020, as per NCRB, 20,615 heat stroke deaths were reported in India. And some reports suggest that over 50% of heat wave deaths could actually be prevented with timely attention as well as awareness. You're getting the information there from the Indian Meteorological Department to all the people who need it. Where is the gap there, and what should be now done? Let's talk about solutions.
Yeah, thank you. And solutions are what we should seek for. We know the problem. The important thing about any environmental exposure, be it a heat or air pollution, as we are here in Delhi, what is required is, first and foremost step is acknowledging the problem. We as a country has acknowledged the problem, be it a heat or air pollution. As a response, of course, the Ministry of Environment, IMD, has done excellent work in giving us projections, alerts for disaster, including heat. Health Department has launched its flagship program called National Program on Human Health and Climate Change. This program is centrally sort of coordinated by National Center for Disease Control in Delhi. And in last 5-6 years, they have made good inroads in terms of developing capacity of the healthcare providers in tackling the health emergency related to the air pollution, heat, and other climate-related drivers. Second, we have also implemented the heat adaptation plan, if we talk about heat specific. What heat adaptation plan means at district level, at state level, what are the actions to be carried out by the health department, what are the actions to be carried out in coordination with the other departments. This is the most important thing. And what are the advocacy and communication related things needs to be carried out at district and state level. Very systematic health adaptation plan has been envisaged and being implemented at district and state level across the country. Second thing regarding data. The data which you have quoted is 80% underestimates. So this number carries no value as such. NCRB data is underestimated most of the time. It is self-reported. As I said, we really need to work, invest, and develop a data for chronic diseases which are impacted by the heat. Symptoms, morbidities, school absenteeism, all these things, other chronic morbidities. So that will give you the quantum of the problem. So investing into the research, data, creating a data repository. As IMD has excellent data repository, on the contrary, health need to develop that kind of data repository so that we can have correlation related studies and that can be used for actions at state level, block level, as well as at the country level. So creating data repositories, investing into health, and third, most difficult part is interdepartmental convergence. You know, we are best in when we work in our department in silos. But when it comes to coordinating with the other department, the IMD, communication, media, health department, education department, we lag behind. So we need a coordinated effort at the state level. Why I'm saying state level? Because health is a state subject, though supported by the center. So state level actions, what we are envisaged and required from state, district, and block and village level. And third point, which I think got missed, is urban heat island effect. As we are developing fastly, the urban population now, hopefully in the next census, will touch 40-45%. So, because of the lot of construction, the urban heat island impact cannot be ignored. The people staying near the road, they have a higher temperature, they are exposed to the higher temperature, though people who are not staying across, away from the road. So we really need to tackle this urban heat island by increasing our green cover, increasing the green space. So it's much coordinated efforts which are required. Thank you.
Missing one actionable step that you will like to recommend for the government policymakers?
I think the policymakers must see that the green cover in cities in particular is increased. If land is not available, then at least terraces, balconies, there also we should increase the green cover. So you just wanted one, so I'll give you one. And if I might give you a suggestion that you have a very strong role to play. The climate clock is telling us that there is just 4 years and 25 days left before we are predicted to tip over that point of no return. And so I fully endorse what Dr. Salve is saying, that communicators have a very, very strong role to play. Just advise people. As I said, human beings want to survive. Why would we do something if we knew that it's going to cause us problems? We just don't know. That is the main problem. So help us know.
And that is the reason why we have this wonderful summit as well. It's the second edition this year, and this is something that we plan to continue so that we, identify these very important problems and, get solutions, get the best experts from around the world so that we get the solutions that the government and people also together can implement. Dr. Mohapatra, what is going to be your one policy intervention that you can suggest or, an actionable step?
Right. So, there has been a lot of actions at the country level and also at the state level. And the most important thing is the implementation of the heat action plan in 23 heat-prone states and union territories. So there could be variation in the implementation from state to state, but it is in place. And there has been guidelines, policy in place. There has been actions based on this, leading to reduction in number of loss of lives. We lost 2,000 lives in 2015. Thereafter, seamless weather forecast, starting with seasonal forecast prediction, then monthly prediction, weekly prediction, daily prediction, accordingly heat action plan implementation. That has resulted in only deaths in single or double digits, sometimes exceeding 100. But still, what we see that morbidity is to be reduced further. So for this purpose, we have to utilize the data. The meteorological data are available, but if you consider the health data, it is not sufficiently available to correlate and establish the heat stress indices for each and every. It will vary from if you go to Rajasthan to Odisha or Rajasthan to Tamil Nadu. The impact will vary depending upon the various regions. So therefore, it is needed to evaluate the impact based on the realistic data from the health sector, other socio-economic sectors, and in association with the meteorological data. Already health department, NCDC and IMD and many others are working together. There are participation of NGOs also. There is also scope for academic R&D institutions to improve further. AI is playing a dominant role nowadays. That is also being utilized. So there is scope to further improve our impact informations, and we can provide very granular information in terms of the warning, in terms of the action suggested, and hence the saving the lives and livelihood.
Absolutely. Collaboration or bhagidari, as they say, is also the need of the hour. I think you also wanted to add something?
Apart from continuing in investing into the climate action and the climate agenda as a country, we also need to go back and learn from our practices. I will share one example. When I was on the research assignment in Gujarat, Dahod, there in that particular village, the panchayat themselves distribute this pagdi during heat wave time to all vulnerable people. They themselves open these water sources where in each farm, panchayat does that work. So we really need to learn from our people who are there, who are practicing since ages, how to get protected, because they are accustomed to the change in the environment, seasonal change. Though we are getting away particularly from the urban area, but we need to learn from our people that how they are adjusting to the change in the environment. And most important thing is, major burden due to all environmental exposure is a non-communicable diseases, hypertension, diabetes.
Right.
In the country, we have 25% people with hypertension, more than 10% with diabetes. So we really need to change our habits, physical activity for 40 minutes per day, at least 5 days a week, more fiber, more fruits in the vegetables, low salt intake. So these are the basic things, but these are essential to change the impact and mitigate the impact of heat. Thank you.
Come back to one thing.
Yes, just 10 seconds. I'm completely out of time.
So I do keep saying that climate education is very important, and I had an opportunity to just speak to the Honorable Minister, and I reminded him that the youth had made a petition to the Honorable Prime Minister that climate education should be mandated in the next round of the NDCs.
Right.
And I said, ho jayega. He said, ho jayega.
Fantastic. Fantastic. We'll leave it there, but thank you very much, all of you, Dr. Mohapatra, Ms. Karuna Singh, Dr. Salve. Thank you very much for joining us here.
Thank you very much to our esteemed panelists for shedding light on such a critical juncture. I would like to request Hina to present our guests and our panelists with a token of our appreciation. Big round of applause, ladies and gentlemen. The applause shouldn't stop, ladies and gentlemen. This is a moment that we are all celebrating and marking this occasion as the second edition of the ICS, which is the India Climate Summit 2025. You can use that hashtag ICS and ICS India Climate Summit ICS 2025. Please do use it liberally, do tag us and share your opinion. Thank you very much, ladies and gentlemen. It's great to have you here with us. Thank you very much.